Good afternoon, class. Welcome to PN Clinical 1. My name is Miss Adams. I will be your clinical instructor for the rest of the semester um, in this 180-hour clinical and 25 hours into the mental health setting. So I just kind of wanted to give you guys kind of a brief overview of what is going to be expected during clinical. Okay, your syllabus is going to be posted on Canvas. So I expect you to read the syllabus, and then you will have an assignment in Canvas. Okay, where you have a couple of questions about the syllabus that you will have to answer in order to get the points for the assignment. Okay. I am not sure exactly what clinical site we're going to be at this particular time. I am hoping it's going to be North Oaks in Hammond. However, it just depends on the COVID situation at hand and how many students they're going to allow into the facility. So there's a lot of pending factors there. Last semester I was on the orthopedic unit, which was on the 5th floor with the accelerated students. But I think they're going to probably be there this semester. So we'll probably be on another unit this semester. Like I said, I'm not 100% sure of what that unit is. Okay, so when you come to clinical, you need to be fully dressed in your uniform. Okay, you need to have if you're cold nature person, you need to have your North Shore scrub jacket on. You can wear an Under Armour, like an undershirt underneath your scrubs, but you cannot wear a sweater over your scrubs. Okay, so it has to be a jacket, your scrubs, and that's it. Okay, you have to have your hair up. Okay, your hair has to be off the collar. Okay, no excessive jewelry. Nails need to be short. No artificial nails. No nail polish. Okay, they need to be nice and clean looking. Okay, and you need to look presentable for clinical. We will, if we're at North Oaks, which I'm hoping we are, we normally meet in the lobby at 6 a.m. Okay, and then we go up to whatever unit that we will be going to. I will give you your patient assignments, and I'm going to be telling you what's going to be expected for the day and the paperwork that is going to be expected to be turned in to me at the end of the clinical day. Okay. Your paperwork will be posted on Canvas. Okay. However, the only thing that I am going to be requiring you to turn in at the end of each clinical day is a care plan on your patients. You will start off the first day with one patient just so you can get acclimated to the unit. Okay, but the next day you will have 2 patients. Okay, and then you will eventually move up to 3 or maybe even 4 patients depending on the census of the unit. Okay, at this time NTCC is not allowing their students to take care of COVID patients. Again, that is COVID positive patients. Okay, now anybody that's rule out COVID, you can take care of them. Okay, but if they become COVID positive, then you're not going to be able to take care of them. Okay, you will be expected to take care of every patient except for COVID patients. That includes patients that are in isolation for C. diff, MRSA, TB. you will be expected to take care of those patients. I had a student last semester that refused to take care of a patient with MRSA. Okay, so she received an F for clinical for that day. Okay, and that is what is going to happen. You have the right to refuse, but you will get a failing grade for that day in clinical. So I just wanted to put that out there right off the bat. Let's see. So some skills that you will be required for clinical, and I wanted to put this out early so that you guys can go and refresh, okay, your memory as far as these skills are concerned, because these will be the skills that you will be expected to perform without instruction, okay, for a demonstration for me on the patient. Okay, you guys have already been checked off on these skills. Okay, you have already been deemed competent in these skills by Miss Traylor and Miss Borders. Okay, so I will not be there to teach you these skills that you have learned in fundamentals. Okay, if you don't demonstrate them to me in a proper way, okay, your grade, you will be penalized for it. Okay, you should know these skills. You should know how to do these skills. Okay, so that's why I am sending you this video early on in the semester, so you can go back and look at these skills and review these skills and refresh these skills so that you can be ready to do them when you get on the unit. Okay, I also have put a list on Canvas of all the different skills that you have been checked off on in fundamentals. Okay, so you have that in a page format, but I'm also giving it to you in an audio format, so you have both. Okay, so skill set number 1 is hand washing, PPE, and bed making. You will have to demonstrate to me how to properly wash your hands. The expectation is that you, at the minimum, sanitize your hands before and exiting the patient's room. So before you do anything with the patient, at a minimum, you need to at least hand sanitize. Okay? If you do not, your grade will suffer for it. Okay, that is basic infection control, basic nursing. The public knows how to do this now. Okay, so you should know, definitely, being a nursing student in the healthcare profession, this should be like a second nature for you to do this. Okay, so I need to see the hand sanitizing before and exiting the patient's room. Okay, and I will also need to see you perform that hand washing, the actual soap and water hand washing process. Okay, PPE, putting on and removing PPE. Okay, you should also be familiar with how to do this. You may have patients that are in isolation for MRSA and C. diff. Those are the two most common ones that patients are in isolation for. So you should know how to put on and take off PPE. Bed making, you learn that in fundamentals. You need to properly learn how to make a bed with a patient in it. Okay. Transfers, gait belts, canes, crutches, and walkers. So you will need to know how to assist a patient if a patient has any one of these assistive devices. You need to know how to put a gait belt on and when to use a gait belt and how to use a gait belt with a patient. Okay. Bathing, oral care, and toileting, you need to know how to do a bed bath. Okay, with a patient in the bed and how to properly bathe a patient in the bed. Oral care, especially if a patient has a tracheostomy, you need to know how to do oral care on the patient. Okay, toileting, You need to know how to properly put a patient on a bedpan and how to give a patient a urinal. Okay. You need to know how to do vital signs. You will be responsible for your patient's vital signs at the start of the shift and at the end of the shift. Okay, so 2 times. You will have to do one time per shift. You will have to demonstrate to me that you know how to do a manual blood pressure. So you cannot just rely on the machines. You have to be able to know how to do a manual blood pressure. You have to know how to listen for lung sounds and heart sounds, okay, and what is normal in both of those, okay, and know how to document them properly. And that brings me to my next skill, which is your head to toe assessment. You need to know how to do a proper head to toe assessment on a patient, and you need to know how to properly document a head to toe assessment on a patient. I will give you samples of documentation and what is expected to be in my documentation. What is expected, what I am expecting you to have in your head to toe assessment. Okay. NG tubes and NG tube feedings are gastrostomy tube feedings as well. Okay, the tube in the nose and the tube in the stomach. Okay, you will be responsible for managing those. Okay, so you need to know how to check for residual. You need to know how to flush a peg tube. Okay, you need to know how to give a bolus tube feeding. Okay. And you need to know how machine tube feedings works as well, okay? You need to know how to do trach suctioning, proper trach suctioning, okay? And you also need to know oxygen delivery. You need to know how to put on a nasal cannula, how to put on a face mask, okay? And what are the oxygen requirements for each, okay? And the way you know that is by looking in your orders. Okay, looking in your physician's orders to see what order the physician has for that oxygen. Okay, is it 1 liter? Is it 2 liters? Is it 10 liters? Is it 15 liters? Okay, these are things that you're going to need to check your chart for. Okay, but you, at the minimum, you need to know how to at least put a nasal cannula on a patient. Ostomy care and Foley insertion. Okay, you need to know how to properly empty an ostomy bag. You need to know how to take the input of that ostomy bag. You need to know how to insert a Foley. Okay, sometimes those are harder than others. Okay, both in females and males. Okay. You need to know how to document each one of those. You need to know how to document a Foley insertion, and you need to know how to document a Foley discontinue when you DC a Foley as well. Wound care. Okay, you need to know how to do forms of wound care such as maybe changing a decubitus ulcer, changing a surgical wound, and changing any kind of skin breakdown wound, okay? And the way you know how to do that, okay, is you're going to follow your orders. What did your doctor order, our advanced practitioner order for that wound to be, what needs to be changed on that wound? But you need to go over your basic wound care fundamental skills, okay? You will also be responsible for doing AccuChecks and blood sugars. Okay, so you need to, if you don't remember how to do an AccuCheck, okay, you need to go back and look at that. I know the machines at North Oaks are they're the AccuCheck brand of machine, okay, at North Oaks that they use. So I will go over how to use that machine when you have an AccuCheck to be done. Okay, I will show you one time, and then you will be responsible for knowing. Okay. Also, some places still use paper charting, so you will be responsible for charting the vital signs and I's and O's as well, either in the electronic chart or in the physical paper chart. Okay, whichever facility we are going to. Hopefully it's North Oaks because they have electronic charting and it's a lot easier. Okay. So back to the paperwork. Your paperwork that you will have, okay, will consist of a patient face sheet. It's a demographic sheet, age, name, diagnosis, okay. It looks kind of like, it looks like this. Okay. This is what it looks like. Okay. So it'll be in Canvas. Okay, you'll see it. So you'll fill out one of these. Okay. You also do a medication list on your patient. Okay, and fill out all the different medications, the order, the dose, the route, and the time of the medication. Okay. And again, I have to stress too that these papers need to be filled out in completion. Okay, completely filled out. If there's something that you cannot find in the chart or that's not available, then you put an NA by that particular area. Okay, not applicable, can't find, okay, but every blank on these sheets of paper needs to be filled out in some form. Okay. Then this will be your head to toe documentation form. Okay. Bring it out. Okay, so this is where you're going to document your head to toe assessment to turn into me for the next day. Okay. This is your diagnostic sheet. So these are going to be all your abnormal labs. Okay. And why are these labs important to the patient's diagnosis as well? So that will have to be turned into me the next day. This is your vital signs, okay, and your I's and O's, okay. Again, this will have to be documented both in the patient's record, in the patient's chart, and on this sheet of paper to be turned into me the next day. Okay. And last but not least, this is your care plan sheet. Okay. This piece of paper will have to be turned into me at the end of the clinical day. This is the only sheet of paper that needs to be turned into me by 3:30 at the end of the day. Okay. So it has your assessment data. Okay. It has your nursing diagnoses. Okay, so what nursing diagnosis are you going to be using for that particular patient? Your plans, okay, for that patient. Plans and goals are the similar. That's kind of like, I use those two synonymously. I use them as like the same word. Plans and goals. Patient will walk 50 feet. Patient will not develop skin breakdown by the end of hospitalization. Patient will eat 50% of their meal by discharge. Okay. So a goal or a plan needs to have a time, okay, and the actual action. Okay. Implementation is what you as the nurse is actually going to do for the patient. Okay. So if your plan is for the patient to walk 50 feet by the end, okay, of the shift, okay, then your implementation will be ambulate patient twice a day, okay? Your implementation will always start off with a verb, okay? Your plan or your goal will always start off with patient will. Okay, so that's an easy way to remember those two because some people get those two mixed up. Okay, so the implementation starts with a verb. Ambulate patient. Assist patient to the bathroom when needed. Turn patient Q2 hours. Okay, administer medications as prescribed. Okay, those are all actions, they're all verbs, those are all implementations that you as the nurse are going to do to meet your patient's goals. Okay, and then the last step, of course, is going to be your evaluation. Okay, did those implementations work? Did the patient meet them or did they not meet them? Okay, and for each implementation, you need to have a goal either being met or not met, okay, for each implementation. And sometimes your goals are not going to be met. That's okay, okay? That's why the patient's in the hospital, okay, to constantly evaluate the progress of what's going on. So it's okay if your patient doesn't meet your implementation. That's okay. They may not, okay? But just, you want to put that in the evaluation. Patient not met because patient was in too much pain to get out of bed today. Okay? All right, so that would be an example of an implementation. Okay? So this sheet, okay, will be due to me at the end of each clinical day. Okay? So that is pretty much all of the paperwork, okay, that will be required at this particular time. I may have, as the semester goes by, I will be adding on different types of paperwork that will have to be due to me regarding procedures of your patients, regarding your patient's diagnosis, and that sort of thing. Okay? But for the first couple of weeks, it's just going to be that basic paperwork that's going to be required. Okay? And again, you will have until the next clinical day to turn the rest of that paperwork, other than the care plan, okay, other than the assessment, planning, implementation, diagnosis, and evaluation, that will all be due the next day. Okay, so I hope this kind of sheds some light a little bit on the document that I have in Canvas. Okay, so again, if you have any questions, feel free to email me or tell me about them. Like I said, those are the skills that you will be responsible for. So I really just want to stress, know those skills, know how to do those skills, refresh your memory about those skills. I know it's been almost a month, okay, since you've probably been checked off on these things, but I need you to go back and refresh your memory about these skills, okay? Clinical is your time to shine, okay? This is your time to show what you've learned, okay? And I look forward to working with each and every one of you.